If the individual is religious, the things she cares about also come out. In fact, these diseases appear in the areas that the person cares about. If you ask what is one of the most virtuous behaviors of a human being, it is knowing what she can and cannot control.
Hello everyone from Istanbul School. Dear viewers, this week we will be talking about religion and mental health. Our guest is Prof. Dr. Ayten. Welcome, teacher.
Welcome. Hello, how are you?
Thank you. How are you?
I'm very good. Thank you very much. Thank you.
Professor, I would like to start with my first question. It is a question that is frequently discussed, wondered about and asked. Do Muslims get depressed?
Of course, if we need to give a short answer to this topic, this question, of course, yes. But why is such a question asked? Why was such an expectation created? We also need to look behind this a little. In other words, there was a general acceptance. In other words, a person with faith lives a meaningful life. Therefore, there is a general expectation that their emotional world does not fall apart and they do not get depressed. But of course, this does not mean that religion or religiosity absolutely protects people from depression, because depression has many causes. In other words, there are many problems that can be associated with biology, psychology, social and spirituality. In our daily lives, such as job loss, loss of a love object, natural disasters, loss of friends, or the corona that we experienced 4 years ago. Because, for example, when people's physical activities decrease, for example, their depressive tendencies increase. Because if you are locked up at home, you will naturally become depressed. But of course, it is necessary to distinguish between depression in the clinical sense and being depressed first. It's one thing to be diagnosed with depression clinically, or it's a slightly different thing whether a person is depressed throughout the day or at different stages of their life.
Yes, we can generally say that we are depressed when we experience a small crisis or a small problem. But of course, the distinction in psychology is different.
Absolutely. That's why, first of all, it is necessary to make a clear definition of depression because, as you stated, depression is a very broad concept. In other words, it is also used to describe minor mood changes. But in the clinical sense, it is a disease that leads a person to commit suicide, God forbid. In other words, it is also a psychiatric disease, depression. In other words, it is necessary to evaluate this in a very broad spectrum. What is meant by depression in the clinical sense is a disease that causes personal distress to a person, causes a person to violate social norms, and especially lasts more than 2 weeks. A feeling of worthlessness, not enjoying any activity in their life that they previously enjoyed, and a completely pessimistic worldview and mental state. There is a biological side to this. In other words, as you know, neurons in the brain are actually the cells that manage our world of thought and our understanding and meaning of life. Brain cells consist of neurons, and these neurons have neurotransmitters that provide a chemical electricity with each other. In other words, an electric current, and these neurotransmitters, in other words, the neurotransmitters that provide the connection between two cells, are found in certain hormones in the brain. Hormones such as dopamine, serotonin, norepinephrine, and disorders, imbalances, excesses, or deficiencies in these are explained by experts as the main causes of diseases such as depression, anxiety, OCD, obsessive complex disorder, or many others. Therefore, first of all, it is necessary to know that depression has a biological side. We cannot deny this. Of course, this is not enough. Instead, there needs to be a driving factor called a psychosocial trigger. In other words, there may be a biological genetic predisposition to depression, but if a person's life sometimes goes smoothly, there may not be a reason to get depressed. But some unexpected, undesirable situations can occur at work. Life does not always flow as we want. And these can be, I don't know, problems at work, family problems with our friends, our spouse, or experiencing social problems that affect the general public or a certain segment of society in any way. And experiencing traumas can be many things called a psychosocial trigger, that is a psychosocial factor, and can lead an individual to depression. So, for example, losing a loved one is a very important cause of depression. These can happen. Of course, there is also a spiritual aspect to this issue. In other words, people who have a more holistic perspective on life and have spread the meaning to the whole of life may have a slightly less depressive tendency or may be more temporary. So when we say depression, we are covering a very wide area and its biological aspect is very effective. And for this reason, psychiatric drugs are used in the treatment of depression. Psychotherapy is applied in addition to it. And in addition, additional supplementary treatment methods such as occupational therapy or strengthening spirituality are also applied, and these need to be evaluated as a whole. Going back to your question, do Muslims get depressed? So what do you understand when you look at these explanations? Of course it can. I mean, Muslims also have a biology. It can deteriorate. They can have health problems. A Muslim's father can die. A Muslim's relationship with his friend can deteriorate, and he can be affected by this. If we understand this in this way, if we interpret it as a person with a strong religion can cope with these issues more easily, he gets support from his religion, he gets support from his religious and spiritual life, then this can be accepted. But you know, a Muslim man does not get depressed by generalizing this. If we perceive a person as having a problem in his faith and religious life, if he is depressed, and if we take this to be a stigma, of course this will not be a very healthy approach.
Yes, it would be a really problematic perspective. So how can religion support and help someone with mental health problems?
Of course, religion has two basic things. Religious and spiritual systems have two basic approaches and two basic contributions to this mental health. One of them is the preventive contribution, which is a very important issue. It gives a perspective that changes the perspective on life in advance and gives meaning to life.
Like a precautionary shield?
It is definitely like a precautionary shield. In our tradition, what we call hygiene is the issue of protecting health, which is an important thing. Because when health deteriorates, it is a process that is not easy to treat and regain. Also supporting coping processes. In other words, as I said, since an illness has many biological, psychological, and social reasons, no matter how careful a person is, sometimes they can catch some illnesses. Because when we say depression, we are talking about an illness that is associated with many things, namely inflammation in the body. So there are many factors. From the biological structure of the brain, what we eat and drink, vitamin deficiencies, our level of movement, everything we experience in daily life is effective in this. And how does a person cope with this during this process when this is experienced? Religion and spirituality can contribute here as well. In other words, if you ask how they do this, the 5 basic functions of this religion are mentioned. Especially in this matter of mental health or when faced with any problem, one of them is the consolation function. Sometimes human beings really try to control everything. I mean, we want everything to be under our control, but there are things we cannot control. In these processes, the religious and spiritual system can provide a temporary sense of control and a consolation. So imagine a person losing a loved one. There is nothing to console a person beyond religious belief here. In other words, the feeling that he died, went to heaven and I will meet him in heaven, or my prayers will reach him, he will receive rewards from the good deeds I do after him, or my happiness or being a good person will continue his good deeds, actually provide a magnificent therapy. It provides a cure for a person, and people who lose their loved ones inevitably experience this, and this performs a consolation function. For example, religion also has a meaning-giving function, because religion is a very powerful meaning-giving mechanism. In other words, it answers the most basic existential questions of a person, such as why are we here, where are we going, and what will happen after we die. And it provides a meaning pattern. That's why it has a meaning function. It gives a sense of control. Because if you ask what is one of the most virtuous behaviors of a human being, it is knowing what he can control and what he cannot control, and striving as much as he can control, but leaving what he cannot control to the power beyond himself. For those who believe in this transcendent power, the intervening power to that. We explain this with the belief in trust in God, with the belief in trust in God in Islam,
It is necessary to understand the difference between these two as a person with prudence.
Absolutely, because it is a virtue. Sometimes people can also hold back from what they can do. In fact, they can intervene, but they don't. Sometimes they perceive things that they can't control, that they can't intervene, as things they can control, and therefore they overload themselves. And this, of course, wears people out. So this is a balance, and that belief can provide it. But if you noticed, the way you use it determines whether it will be harmful or not beneficial. In other words, the person's personality there is also very important. In other words, some people can evaluate religious and spiritual facts very wrongly and overload themselves too much. Another issue is self-development. Especially when you look at it in the Sufi culture, people can see what they experience as a part of their spiritual maturity and personality maturity. In other words, we live a life, and this life continues like a long journey with ups and downs, and we see this life as a test, and we experience a maturation process as a result of what we do in this world of tests.
Like reaching perfection.
To reach perfection. It talks about evolution. So of course this is not an easy process, and it is a lifelong process. In fact, religion and spirituality give this to the person. It gives this perspective. There is something these experiences of mine want to tell me. There is something it wants to tell me, and when I receive this message, I see it. I can bring it to my life, and by eliminating the deficiencies in my life, I can become a better person. In other words, a better person than I was yesterday. And of course, this prevents the person from falling apart. It allows them to collapse and recover. It also has such a contribution. That is why 5 basic functions are mentioned. We can say these in terms of religion and mental health.
Okay, teacher, there are also many definitions of psychological disorders that are tried to be named under the guise of religion, such as evil eye, possession, etc. There is also magic that we use in our culture. How does religion actually see these? What is its perspective on these?
Of course, there are differences between psychology and religious culture. But of course, we need to combine these. We try to do these in religious psychology. Of course, there is a general principle. In other words, psychological disorders are universal things, and things that occur in every society and in certain percentages in almost every society. But the way they appear in every society is different. So let's say a person with different allegiances and delusions can claim to be the Mahdi in our societies. For example, there are Mahdis, people who claim to be prophets in psychiatric clinics, and they are receiving treatment. In another culture, in Indian culture, it appears under a different name. In Christian culture or Jewish culture, it may appear under a different name. Therefore, the way these psychological disorders emerge in cultural and religious environments, it is necessary to be careful about it. For example, OCD cases are generally seen in 3% of all societies. What do we mean by OCD? It is a disease of obsessive and compulsive thinking and behavior. We call it anxiety. In society, anxiety is generally called anxiety, but anxiety is used for something simpler. There is a concept called scrupulosity in Western literature. It is a concept somewhat similar to anxiety, but obsessive thinking. In other words, it can occur as my hands are dirty and I go and wash them, or when I do my ablution, I forget my elbows or my heels, or I think I haven't washed a part of my body and I keep washing it, and this takes a very long time. This is how they appear. These diseases are diseases that have a biological basis in every society. As we explained in the case of depression, OCD is also a disease that has a biological basis, but the way it emerges is due to cultural elements. In other words, in Christian culture, diseases such as cleanliness disease, symmetry disease, counting disease, and baptism can occur more. In our culture, if the individual is religious, such problems occur more in the things they care about. In fact, these diseases emerge in areas that people care about. In other words, for example, our health is important to us, and things related to our health, such as infection with viruses, catching diseases, or home, for example, is important for people. Family is important, for example. It can turn into anxiety in those matters. Or religious elements are important to the person. In that matter, it turns into things like whether my ablution was completed, whether my prayer was accepted, whether my ritual bath was completed. But what is important here is not the person's level of religious knowledge or religious behavior. What is important here is the person's biology. We should not forget this. In other words, since the biological structure is damaged, those issues are reflected in that way. In other words, the symptoms emerge with religious and cultural elements. In Christian culture, this emerges in a way related to church, going to church. In Indian culture, it emerges with its own religious and cultural elements. In our culture, it is more like repeating ablution, not being able to start prayer, inappropriate thoughts coming to mind during prayer. For example, a person goes to prostration, very bad thoughts come to mind, and this disturbs a person very much. These may emerge, but their solution is not sought in the area where they emerge. In other words, this is not an issue related to the person's religiousness. It is actually something related to their biology, psychological structure. This person needs to receive psychiatric and psychological treatment. In fact, when they receive that treatment, when they receive that psychiatric and psychological treatment, those symptoms also disappear. In other words, for example, the person experiences delusions, hallucinations, thinks they are possessed. But instead of going to a therapist, a witch doctor, a spiritist, when they go to a therapist, they receive the necessary treatment, medication, or psychotherapy. If necessary, a religious person can also be consulted, because their involvement in the process can be a thing. In other words, they can contribute to the process being managed in a healthier way. Because sometimes people can perceive those symptoms as the cause of the disease. That's why they try to solve the issue in a religious area, or they try to solve it in a cultural area. Of course, there is a famous story, it is told in Eastern stories. A man says he lost a needle somewhere and he tries to look for it there for a long time. The people around him are curious. Why couldn't you find it? I mean, why did this happen? When I questioned him about why couldn't you find it, he says, I didn't lose this needle here. He asks, why are you looking for it here? Because there is light here, he says. Because that light is here, I look for it here. Actually, sometimes we don't look for our problems in the causes. We look for it more in the results. Actually, that result, that symptom, does not point to the cause. That's why the person needs to go and solve his biological problems, psychological problems. When he solves them, he gets rid of these problems. That's why it is necessary to know that such issues have a very cultural dimension. But it is necessary to read it in an interdisciplinary way. In other words, it is necessary for both a psychiatrist, a psychologist, a clergyman, or a spiritual counselor who deals with these issues to be involved in the process. I believe that it can make something that seems unsolvable or scattered over long periods of time and processes more solvable.
Spiritual counseling, can you briefly talk about that? What is spiritual counseling?
Spiritual counseling is something that has been around for many years in Europe since the 1930s. In our country, it was started to be implemented in the 2010s, even after 1995. But in fact, spiritual counseling is more about the individual's coping process. That is, the individual who is experiencing any difficult situation, an unwanted, unexpected situation, is supported spiritually and religiously in the process of coping with these difficulties. In our country, spiritual counseling is mostly thought of as a study for disadvantaged groups, and the Directorate of Religious Affairs mostly does this. What do they do in general? In fact, it is applied in the form of supporting the coping processes of people who can be described as disadvantaged groups, such as women, the disabled, the sick, the prisoners, the relatives of prisoners, the relatives of patients with religious and spiritual elements. This is the practice in Turkey. It can actually contribute to the process quite a bit. Why? Because, of course, psychiatrists and psychologists have problems reaching the public. The involvement of theologians who know religion and culture better, or the personnel of the Directorate of Religious Affairs in this process, both relieves their burden and ensures that the process continues in a healthier way. But of course, the people who will perform this spiritual counseling duty here also need to receive a good education. In other words, they need to receive such training as counseling skills and interpersonal communication in order to properly carry out that process. They should not make interventions that may fall within the scope of psychologists and psychiatrists. In other words, they need to know their limits. If these rules are followed, I think spiritual counseling can be a supportive and complementary element of psychiatrists, psychologists, and social workers, especially in social service areas and such problematic areas, hospitals, prisons, youth centers, women's shelters, addiction centers. But as I said, they need to receive a good education because this process is a bit of a counseling process. It is more people working in the Directorate of Religious Affairs or in the Directorate of Religious Affairs focus more on preaching, more on speaking, and because they receive such training, they receive a bit more counseling training such as listening and developing empathy skills, and this is what is already being done. Because graduate programs are being opened in the fields of spiritual counseling and professors from psychology and PDR are providing them with such training. In fact, this is a need brought about by the urbanization of modern times. Because in modern life, people need to solve their problems in institutions. In other words, think of a person staying in a hospital, for example, a patient in an oncology clinic. He stays there for 5-6 months. He experiences many crises of meaning in his life. Receiving spiritual support during this process, if he has his own direction and wants it, of course, can contribute greatly to the process. And those who brought these issues to the agenda, especially in hospitals, were mostly nurses and doctors. They pointed out the existence of such a need. This issue needs to be evaluated in this way. Problems in modern times are also very complicated. More interdisciplinary perspectives need to be developed to solve them. Spiritual counseling is one of them.
It really seems very important, teacher. For those who don't know, maybe it was a short explanation. Thank you very much.
I thank you.
Thank you, teacher. Dear viewers, we talked about religion and mental health today. See you in the next episode. Goodbye.